A story that once symbolized hope and medical breakthrough has taken a heartbreaking turn, as one of the conjoined twins separated in Limpopo has died following complications after what was initially described as a successful surgery. Stay tuned as we bring you the full story. Good evening. You're watching Izwi Newsroom Africa, the voice of Africa. Tonight, we bring you a deeply emotional and developing story involving a set of conjoined twins whose journey had captured public attention and inspired hope across the country. According to available information, one of the twins, who underwent separation surgery in March, has sadly passed away due to complications related to organ failure. The procedure, which was reportedly carried out at a hospital in Limpopo, had initially been described as a success. Medical teams had worked extensively to separate the twins in what is widely understood to be a highly complex and delicate operation. Separation surgeries involving conjoined twins are among the most challenging procedures in modern medicine. They often require months, sometimes years, of planning, involving multidisciplinary teams of surgeons, anesthetists, and specialized care units. In this case, early reports following the surgery suggested that the operation had been completed successfully, offering hope that both children would recover and eventually lead independent lives. The development had reportedly drawn national attention, with messages of support and encouragement directed toward the medical team and the family. It is also understood that the successful completion of the surgery was acknowledged at the highest levels, with congratulations reportedly extended in recognition of the medical achievement. However, despite the initial optimism, the situation has now taken a tragic turn. According to reports, one of the twins has died, with organ failure cited as the cause. The exact medical circumstances leading to this outcome have not yet been fully disclosed in detail.
As the provincial government, firstly we want to send our message of condolences to the Stolle family, because around late last night, one received a call because we usually receive updates from the team to say our twin A it's not doing well, and early hours of the morning he succumbed to multi-organ failure as a result of preliminary diagnosis could be sepsis, septicemia resulting from infections.
Organ failure in post-surgical cases can occur due to a range of complications, including the body's inability to adapt to newly independent organ systems, infections, or stress placed on vital organs following a major operation. Medical experts often caution that even when separation surgeries are technically successful, the recovery phase remains critical and can present significant risks. The human body, particularly in young patients, must undergo a major adjustment after separation, especially if organs were previously shared or functionally interdependent. At this stage, a detailed clinical breakdown of what led to the organ failure has not been publicly released. What has emerged is that the hospital involved has reportedly issued a statement expressing deep regret over the loss. Such statements typically acknowledge the efforts made by medical teams, while also extending condolences to the family. The loss of one of the twins marks a profoundly painful moment, not only for the family, but also for the healthcare professionals who were involved in the procedure and post-operative care. Hospitals undertaking such complex procedures often operate under immense pressure, balancing hope, medical risk, and ethical considerations. Despite the tragic outcome, cases like these are often viewed within the broader context of advancing medical science, where each procedure contributes to greater understanding and future improvements in care. At the same time, the emotional impact of such outcomes cannot be understated. Public reaction to the news has reflected a mixture of sadness, sympathy, and reflection, as many who had followed the story now respond to this unfortunate development. There is currently limited confirmed information regarding the condition of the surviving twin, or the next steps in terms of ongoing medical care. As with all developing medical stories, further details are expected to emerge, as official statements provide additional clarity. Before we conclude, it is important to approach this story with sensitivity and perspective. While the surgery itself may have represented a significant medical milestone, the outcome highlights the reality that complex procedures carry inherent risks, even under the most skilled care. Families who consent to such operations often do so with hope, courage, and an understanding of the uncertainties involved. Medical teams, on the other hand, continue to push the boundaries of what is possible, while navigating outcomes that are not always predictable. This is Izwi Newsroom Africa, the voice of Africa. Our thoughts remain with the family during this difficult time. Stay with us for more updates.